So good morning, magandang umaga, as we say in Tagalog. So again, my name is Ben de Guzman, obviously, as the director for the Mayor's Office on Asian and Pacific Islander Affairs. And I wanted to thank you for coming to take the time and talk to us about the story of the Philippine Nurses Association here in Metro DC. So let's start by having you share with us your name and your title.
Sure. Good morning, Ben. First, I want to thank you for giving us a platform to be here with you and be able to echo out what Philippine Nurses Association of Metro DC has been doing for the community. I'm Lourdes Carriega. I'm the immediate past president of PNA Metro DC, and I now serve as one of the member of the board of directors for the Philippine Nurses Association of Metro DC.
Great.
So, thank you for having us here.
No, thank you. So, first of all, congratulations on the 50th anniversary of the PNA Metro DC chapter. Can you talk to us a little bit about what the PNA is and sort of its history?
Um, the gala was such a successful event, and actually, for us, we really looked forward to that event. COVID and all, we were praying hard that the event would push through. It was a celebration of all the things that Philippine Nurses Association has done for not only for its members but for the community, and not only for the local community in Metro DC but also for the Philippines, because we've had several medical missions that we have done for all mainly about 18 or 19 medical missions in the Philippines since the inception of PNA Metro DC in 1971.
Yeah. So the gala was a couple of weeks ago, right?
Yes, it was.
And it really talked, as you said, it really brought forth not just the Filipino community here, but the Philippines and the impact that you've had internationally, right?
Right.
So Ambassador Romualdez was there, right? And so many luminaries from the Filipino community and the Asian American community were there. How do you see? From what I understand, 50 years ago in 1971, the PNA chapter here formed to really support nurses in passing some of their board exams. Is that right?
Right. I think there was a need during that time. There were several Filipino American nurses who are trying to, comply with the state board rules of having to be licensed here in the country.
Mhm.
And Tess Cotarucci, one our founding president, responded to that need. There's a problem. We have the capacity to be able to help this group of nurses, and her efforts were to try to help out the best that she can in preparing these nurses into successfully passing their state boards and be able to navigate the nursing profession as Filipino American or Filipinos in a new country.
Mhm.
So,
So, in the interest of full transparency, my aunt has been part of the leadership of PNA over the years, and seeing her be part of this really critical support system for nurses, as you say, coming from the Philippines, to be here, to become Filipino American nurses, right, and to be part of the American medical system here, right. So the statistics, as they've been reported out, indicate that only 1% of the U.S. population is Filipino, but 4% of the nursing industry profession is Filipino, right? So we're, the narrative that every Filipino knows a nurse in their family, right, is true for me. It's true for your family, obviously. How would you describe the relationship between our community and its nurses? Like, how do you feel like as a nurse in our community?
I think nurses in any part of the country or any part of the globe has the capacity and high capacity to be able to be of service to the communities that they belong to. And as nurses, we've had the privilege of being able to know the spectrum of the needs of patients around us, not just on a clinical professional practice setting, but I believe as we continue to evolve, our capacity to be able to contribute to being engaged community members and also being part of the navigation of how the community can be a level of health, um, you know, especially with the onset of pandemic, like in 2020, that was sort of like a wide an eye opener for all of us. How the value of nurses in the communities is so impactful. We as nurses are able to provide the presence of ourselves, being role models for healthy behaviors, trying to address vaccination hesitancy, um, educate the public on, because COVID issues were all over the place. We have so many, questions and myths to bust. And I think as trusted healthcare professionals for 19 years, survey shows how communities and people, not just like our colleagues, but members in the community, trust the nurses in having the most ethical, trustworthy healthcare professionals. And I think the opportunity for us to be able to leverage on that capacity to influence behaviors in the community, not just in our practice settings, but to try to offer that opportunity for our community members to know that we could all collectively get better and we could all collectively get out of this pandemic.
Yeah.
You know,
No, I think that's right, and we'll go into the COVID-19 pandemic also, but I wanted to kind of pull out two things that I'm hearing you say, because on one hand, our nurses in the Filipino community are driven by this need to serve, this need to help, this need to, this drive to, be supportive, and, whether or not that's endemic in our community, like the spirit of bayanihan, or like giving back to to the public good, or whatever, I feel like that's out there. But at the same time, as you're saying, for 19 years now, there's been survey research or information out there that indicates that the nursing profession is seen as being ethical, is seen as being respected and trusted. And it's your opportunity at the intersection of our community and that industry and the profession that's so well respected to be able to do even more good at this time. Right. Is that kind of, I feel like that's my takeaway of what you're saying.
Yeah, and I as Filipino Americans, just like you said, at the core of our values on the Bayanihan spirit, it's giving our hand to the community, and that value has not gone away, regardless of how many years these Filipino American nurses have been here, fully acculturated in the country. The Bayanihan spirit exists in a way where we cannot isolate ourselves in such a way where, I'm safe in this small area where my family is okay. As nurses and Filipinos, we have that concept of bayanihan where we have to continue to think about what is collectively, how safe is it for everybody. My safety is not just sole priority. And I believe that that's how Filipino American nurses had been. And I see it, as member of the Filipino Nurses Association of Metro DC, that platform has been echoed out. Like our opportunity, especially with our partnership with the mayor's office and with you, helping us, be given this opportunity to be able to be out there and serve the community in ways that we could as safely as we can, and as culturally and linguistically adaptable to what our community needs are. Like Filipino Americans are still by nature very respected, within the they highly value family values.
Respected and respectful.
Right? Respected and respectful, yes. That's correct. And
so as we go into the COVID-19 pandemic, I did want to, in a previous life, I was a teaching assistant for our Tagalog language program. So I feel like part of me wants to make sure that our audience understands that this concept of bayanihan, right, like kind of giving back to the community, and the image that we often invoke of a village coming together to help move that hut out of the dangerous, like flooded zone into safer ground. I feel like that's the image that we associate
Yes.
with it, right? And so it's really that drive for public service, whether it's what drives me as a city government employee or whether it's you all as nurses. For me, that's where I trace the work that I do from. Right. But let's talk a little bit about COVID-19. Can you talk a little bit about what PNA has been doing for the past 20 months now?
Oh, yes, of course. So when COVID hit last year in March, we actually were all just returning back from the medical mission that we had back in the
Yes,
Philippines.
that's right.
So
In fact, my auntie didn't make it.
yeah,
She was still there for a number of months afterwards.
yeah, she was delayed,
Yes.
and we were all like, praying and making sure that she was able to get to return as safe as she can. Because
She was safe.
yeah,
Thanks to your prayers, probably.
but we wanted to ensure that first and foremost our members and our family members as well as the members of PNA Metro DC continues to be safe.
Mhm.
That's one priority. We wanted to stay as focused as we can to the mission that we have, like making sure that we stay as relevant as we can to the community, to the Philippine American nursing community as well. And so we worked on initiatives that would be sort of like responding to that. And we had masks for the peak at the time. The PPE was of such crisis.
Mhm.
We distributed disposable masks. We distributed face cloth masks and disposable masks to senior residents in the community. We also had rolled out the emotions behind the mask survey. It's a project that we had with our membership engagement committee, where we identified that our Philippine American nurses are suffering during the as frontline healthcare workers, and behind that mask, we identified certain needs that they have, their coping mechanisms, and how can PNAMDC be responsive to that, in offering programs and initiatives that would be helpful for them. So we ended up having activities from that. We gathered information that they felt most comfortable having a social group that they could relate to.
Okay.
So virtually, we pivoted to virtual platforms and be able to do some, things like that with them.
And you've been able to do things like informational
Right.
virtual sessions and that sort of thing.
As it evolved, yeah, we did those. We pivoted. First of all, we were doing 100% physical meetings and like our educational conference became virtual with COVID. We pivoted to that platform, and we went to educating the community as well with the ways of how to protect themselves and the constant ways of navigating the evidence-based information and how to process that accordingly. We addressed vaccination hesitancy, and with partnerships and collaborative efforts with organizations such as the Philippine Medical Association of Washington D.C. Dr. Natalie Quillon and I, discussed that there's mutuality of purpose. Why could we continue to work in silos when we could leverage our work together and partner in addressing vaccination hesitancy in the community? And she helped us, put together this educational webinar for
Great.
that.
And then most recently, helping us with our vaccination clinics
Right.
in Iglesia.
I think those initiatives came on, through the early part of 2021, as we are now trying to navigate the re-entry. And with Carol Robles as the president of PNA Metro DC, we worked on those collaborative work with the mayor's office in trying to address vaccination hesitancy as well, and offering vaccination clinics. Because I think there is really such a sort of like a decline in people's response to being convinced that vaccination works, and we needed to address that so that we could increase the rate of vaccinations in the community.
No, that's great. So So then we've celebrated 50 years of PNADC. What do you see in the next 50 years?
Um, I am very optimistic for the future. We have a president here, Carol Robles, who's really working on ways to ensure that we have programs and initiatives that offer the opportunity for our nurses to be able to give back to the community and partnering with various organizations such as Moapia, the American Diversity Group, with partnering with Philippine Nurses Medical Association. There are various community organizations out there that are similar, that have mutual goals with us, and the ability of us to be able to work with them together and be part of that is just going to echo out a highly visible and impactful outcome for our community.
Great. Is there anything else that you feel like you want to say, a part of the PNA story over the past 50 years that you think would be helpful for the folks who are watching this?
I think just wanted to make sure that I emphasize the value of nurses, and not just because I'm a Filipino American nurse, I'm a proud Filipino American nurse, but the value of nurses regardless of ethnicity. And being part of the community and not just being sort of like buried in the clinical practice setting or your professional work, and trying to navigate that if you're sort of already addressing the outcome that you have within the particular setting, that it's fine and good. I think nurses should have the ability to expand that to where they are highly visible in the community and engage in it and collectively pull in people out there in the community who are really hungry and thirsty for information that really is trustworthy enough to hang on to.
Great.
I think that's the value of what nurses and nursing should be.
Well, as a district resident who benefited from Filipino nurses at Howard University Hospital when I went there for care, I can attest firsthand to the impact that you've had in the district, in the region, and in the country. So, so I just wanted to thank you for your time and for all of your service and for the great work that our nurses and PNA have done here for the residents of Washington, D.C., and for the Filipino American community. So thank you very much.
Thank you. Please call on us anytime.
Yes.